Painful periods are just part of being a woman. Sounds familiar? Maybe you've been told that exhaustion, bloating, or crippling cramps are normal. Maybe you've been handed birth control pills, antidepressants, or even told it's all in your head. Let's set the record straight. This is not normal. What you're experiencing could be endometriosis, a chronic, progressive condition that affects an estimated 1 in 10 women of reproductive age, but often goes undiagnosed for years, sometimes even decades. In this video, we're breaking the silence. We'll unpack what endometriosis really is, how it impacts more than just your period, and why millions of women suffer in silence, often without clear answers or support. Whether you're dealing with mysterious symptoms, navigating fertility challenges, or supporting someone who is, this video is for you. Let's start. Endometriosis is a condition where tissue that resembles the endometrium, the lining of the uterus, starts growing in places it doesn't belong. It can be found on the ovaries and fallopian tubes, on the outer surface of the uterus, on the bladder, rectum, and intestines, inside the abdominal cavity. In rare cases, even on the lungs, diaphragm, or brain. This tissue acts like uterine lining, responding to hormonal changes. It thickens, breaks down, and bleeds during each menstrual cycle. But unlike your period, it has no exit route. Instead, it becomes trapped, triggering. Chronic inflammation, painful adhesions, scar tissue that fuses organs together. Ovarian cysts, endometriomas, nerve irritation, and immune dysfunction. Over time, endometriosis becomes more than a bad period. It's a systemic disease that can affect the digestive tract, urinary system, immune function, fertility, mental health, and more. The systemic impact of endometriosis. It's not just pelvic pain. Endometriosis is now recognized as a whole-body inflammatory and neurological disease. Some of its far-reaching effects include gut issues like bloating, diarrhea, constipation, and nausea, often mistaken for IBS, bladder pain or interstitial cystitis, back pain, leg pain, and even nerve pain, fatigue that doesn't improve with rest, painful sex, ovulation, and even pain while sitting or moving. Over time, the constant pain rewires the nervous system, a phenomenon called central sensitization, where even light pressure or movement becomes agonizing. Meanwhile, inflammation disrupts immune signaling and hormone balance. This is why so many women also struggle with thyroid issues, autoimmune diseases, chronic fatigue syndrome, mood disorders including anxiety and depression, endometriosis effects, 1 in 10 women of reproductive age, girls as young as 11 or 12, people of all ethnicities, backgrounds, and body types. Those with a first-degree relative who had endometriosis are 7 to 10 times more likely to develop it. But here's what's shocking. It takes an average of 7 to 10 years to get a proper diagnosis. Why? Many doctors still believe painful periods are normal. The symptoms are dismissed or misattributed to IBS, anxiety, or hormonal imbalance. Imaging like ultrasounds often miss lesions unless they're large cysts. And laparoscopy, the gold standard for diagnosis, is invasive and not always offered. You should never ignore early symptoms. Endometriosis doesn't look the same for every woman. But here are some major red flags. Period pain that interferes with daily life. Pelvic pain between periods. Pain during or after sex, particularly deep pain, painful bowel movements, or urination. Severe bloating that can last for days. Heavy or irregular bleeding. Chronic fatigue, trouble getting or staying pregnant. Some patients also experience migraines or hormonal headaches. Lower back or leg pain. Shortness of breath, in rare thoracic endo cases. Recurrent UTIs or bladder pain. Notably, symptom severity doesn't correlate with disease stage. A woman with stage 1 endometriosis can be in debilitating pain, while someone with stage 4 may feel nothing. Endometriosis is one of the leading causes of infertility. But how does it impact your ability to get pregnant? 1. Scar tissue and adhesions can block or twist fallopian tubes. 2. Inflammation damages eggs, sperm, and the environment for embryo implantation. 3. Endometriomas can reduce ovarian reserve and damage surrounding tissue. 4. Ovulation may become irregular or painful, affecting timing. Still, many women with endometriosis do conceive, with or without treatment. And there's hope. Excision surgery, not just ablation, can restore fertility. Assisted reproductive technologies, ART like IVF, show much higher success rates post-treatment. Freezing eggs early is an option if you're not ready for kids but want to preserve fertility. Diagnosis, why it's so hard, and what you can do. Unlike many conditions, there's no definitive blood test or imaging scan to diagnose endometriosis. Here's what diagnosis typically involves. Symptom tracking, often your most powerful tool. Pelvic exams, limited as lesions can't always be felt. Ultrasounds or MRIs may show cysts or adhesions, but not all cases. Laparoscopy, minimally invasive surgery to view and biopsy lesions. The gold standard. You must be your own advocate. Keep a detailed symptom diary. Insist on seeing a specialist in endometriosis, not just a general OB/GYN. Ask about excision versus ablation surgery. The difference matters. Get a second or third opinion if your concerns are dismissed. While there is no cure for endometriosis, treatments can help manage symptoms and improve quality of life. 1. Pain management. NSAIDs, ibuprofen or naproxen, can dull mild pain. Pelvic floor therapy. Trained physiotherapists help release muscle tension and reduce referred pain. Neuromodulators. Some patients benefit from medications like gabapentin or amitriptyline 2. Hormonal therapy. Birth control pills or IUDs help suppress ovulation and reduce flare-ups. GnRH agonists temporarily halt hormone production but have major side effects. Progestins, such as Vizan or the Mirena IUD, help some but not all three. Surgical intervention. Excision surgery removes lesions at the root, superior to burning them. Ablation. Laparoscopic surgery, minimally invasive with better recovery. Hysterectomy only helps if all disease is removed, not a guaranteed fix. Finding a surgeon trained in excision is critical. Most general OB/GYNs lack this skill. 4. Lifestyle and integrative support. Anti-inflammatory diet. Many patients report improvement after reducing sugar, dairy, gluten, and processed foods. Supplements, omega-3s, magnesium, turmeric, and NAC are being studied. Stress reduction. Yoga, mindfulness, CBT, and body-based therapies can all help. Support groups to connect, share, and feel less alone. What doctors don't always tell you, but you should know. Just get pregnant is not a treatment. Symptoms may return or worsen postpartum. 2. Hysterectomy isn't a cure. Endometriosis outside the uterus can remain. 3. Endo doesn't always show up on scans. Lack of imaging evidence doesn't mean nothing's wrong. 4. Birth control isn't a one-size-fits-all fix. It may relieve symptoms, but it won't remove lesions. 5. Many OB/GYNs aren't trained to recognize or treat advanced endometriosis. You may need a specialist. 6. You are not imagining your pain. If a doctor minimizes your symptoms, seek another opinion. You deserve answers. Endometriosis is complex, it's exhausting, and it's often invisible, but you are not alone. And you are not powerless. If this video resonated with you, please like, subscribe, and share. Let's raise awareness and support each other in demanding better care, better research, and better outcomes. Let's break the silence. Together. Stay informed, stay healthy,